I'm going to open this video with a disclaimer. This is just my experience. This is not medical advice. Please don't take this as a medical diagnosis from me. I am not a licensed physician. I am not a doctor. This is just my lived experience. But if you can relate to what I'm about to share, please, please, please go get a second opinion, a third opinion if you have to. Because I feel like a lot of women have been misdiagnosed with endometriosis when that's really not what this is. So stay tuned. Guys, welcome back to my channel. Today we're going to do a little story time. I have to tell you guys about my experience with OBGYNs and my experience with being misdiagnosed with endometriosis and how I got to be pain free. Okay, I was dealing with pain in my abdominal area for about 4 years, and the pain started right after the pandemic. So I would say about 2021, I started to have this really sharp pain in my abdominal area on the left lower side, and it would be irritated every time I wore pants. It would be rubbing up against it. It was almost like hot to the touch when I would be going through my cycle. I would have really sharp stabbing pains when I sneezed or when I coughed. And then I started to feel an actual lump in that area. So I went to my OB at the time, and she was a black woman. And I was intentional about that because I felt like, well, surely she's going to empathize with me. We're going to be able to get something figured out because it's a sister, right? Wrong. She was extremely dismissive. She kind of blew me off. I'm not even gonna say kinda, she definitely blew me off. She didn't even touch me. She had her residents touch me because I was trying to get her to feel the knot in my abdominal wall, and she didn't even put her hands on me. She got one of her residents to come in, and he felt around, and he kind of did a little pat and knocked around, and he was like, it's definitely something in there. And she was like, well, it's probably a cyst and it'll pass with your period. And I was like, no, I've had cysts before that come and go. This isn't a cyst. I've never been able to feel a cyst, on my ovary through my abdomen, just touching on it. It was sitting up high. It was hot. It was sensitive, like a shirt rubbing against it. I could feel it. I was like, no, this don't feel like that. So she blew me off, and she gave me some birth control, and she was like, this should help pass the cyst and you should be fine. So of course I took the birth control, and it didn't work, and birth control has never been my friend. So I wasn't shocked by that. So then I went back to her again. So then she ordered a CT scan. Now, I ended up getting to run around with the CT scan because they were just unprofessional. I would show up for my appointment. They would say I'm not on the books. They got to reschedule me. It was just a mess. But that's besides the point. I got the CT scan, and they saw the growth in my abdominal wall on the CT. So they were saying it looks like it may be an endometrioma. I'm like, okay, now we're getting somewhere. So I go back to her for a follow-up, and she basically tells me there's nothing else we can do. I'm like, I'm sorry, what? She's prescribed me so much tramadol in order to deal with the pain every single day. But that was her answer, to take tramadol when it hurts and go about my life. I wasn't accepting that. I was not taking pain as an answer. No, I'm not going to be in pain every single day and on pain medication just to no, we're going to get to the source of the issue. So fired her, had to go find me somebody else. So I went to this other well-known doctor. He will go unnamed because he's currently under investigation and possibly going to do a lot of prison time for misdiagnosis, SA charges, using single-use materials on multiple patients, all types of things. They don't currently have him in prison because they have a lot of evidence against him, and he should be being held in prison right now. But that's a whole nother story for another day. Long story short, I went to him because he was like supposed to be the best of the best when it comes to endometriosis. So I go to him to get another opinion, and he orders another CT scan. I do another CT scan. He says it's an endometrioma in your lower left abdominal sheath wall. situation. So I said, okay. After that, I went back to him, and he was telling me that the only thing they could do is put me on a medication that's like a hormonal medication. I think it's called Lupro or Lupron or something like that. And he was telling me that it was basically going to send me straight into menopause. So I said, absolutely not. I do not want to be on any medication that's going to put me straight into menopause. I'm 33 years old. So I said no to that. So he said, well, the only other option is to do a surgery to remove the endometrioma off your abdominal wall, but I can't guarantee that it's not going to come back, because if you know anything about endometriosis, getting the lesions removed does not mean that they're going to stay gone. They can come back. They can spread. It can be like poking a bear sometimes. And I knew that was a possibility, but the pain was so annoying. Like, it was messing with my... I would get overstimulated easily, because if you can imagine being in pain every single day and you have this hum, what I call it is like a hum of pain in the background. I could overlook it, I can function, but it's still there like a fly in my ear. So on top of life's already ness, I have this pain ongoing in the background. So I was desperate. I was like, I don't care. Let's just remove the endometrioma. Let's do the surgery. And my prayer is that once y'all get it, it won't come back. And we won't have to go through this again. So I went through the surgery. I got the endometrioma removed. And like the first week of recovery, I was noticing that it felt like the knot was still there. I'm like, I don't feel like the knot went anywhere. And the tenderness and the irritation was still there. So when I went back for my follow-up after surgery, like my post-op follow-up, I even went back before it was time. I said, something is not right, because it still feels the exact same. It feels like I got cut and sewed back up, and that was it. And nothing changed. What is going on? So he told me that, okay, you just have to give it time. It's going to take a minute for it to heal. The inflammation has to go down, da-da-da-da-da. I'm like, I hear what you're saying, but this don't feel right. I don't feel like anything has changed. So 6 weeks went by. The knot was still there. The pain was still there. And I just had a new scar to add on to the collection of scars from my past 2 C-sections, right? So I kind of just, after that, got burnt out with trying. I was just fed up. I'm like, nobody's going to be able to fix this, so let me take matters into my own hands. So I started doing my own research about how I can change my diet, what supplements I could take to help alleviate the pain or make it bearable. And I can honestly say going with a pescatarian diet did help a lot with the inflammation. I feel like it made it a little more bearable, but nothing was curing the issue. Nothing gave me zero pain every single day. Nothing. So I waited about, I shouldn't have done this, but I waited about my surgery was in 2023 when I got the endometrioma removed. I just went to get a third opinion, since my OB at the time, the last one that's in trouble, when I found out that he was in trouble, it started making me rethink everything he ever told me. And for good reason. Because I'm like, this man can't be trusted. So I need to get another opinion. And I waited way too long. I'm not going to lie. I waited like a whole nother year after that. But now it's 2025. I did this on the 29th of December, 2025. So this was like last week. And I went to go get another opinion. And this doctor was an older white man. He gave me House energy. Do y'all remember that show, House? House knew his stuff, but he was very unconventional. That's how this guy was. He walked in the room. He had his resident with him. He's teaching her what she needs to know. And she was so sweet. But he knew exactly what the problem was. When I told him everything, I told him my history, he said, I need you to lay up on the table for me. I get up on the table. Y'all, he puts his finger right on the spot. He said, it's right here, isn't it? I was like, girl, y'all, I could have got up and ran. I said, yes, that's exactly where it is. That's the spot. He said he knew exactly what it was. And he asked me a few more questions. He felt around. He was like, does it hurt here? Does it hurt? I'm like, nope. All of those areas are not the problem. It's that first spot you put your hand on. He was like, okay, I'm just trying to make sure that I'm on track with the right thing. And he was like, well, when you got the surgery and they say they removed the endometrioma, like, what else did they tell you? I said, really nothing else. They just told me they removed it, and I let them know that it was still hurting even after that. And they just left it at that. They didn't prescribe me tramadol, but he was like, either you're getting on these hormones or you're going to have to deal with the pain every day. So I didn't want to do either of those. So I took matters into my own hands and changed my diet, and that helped with the pain a lot because it was kind of like an anti-inflammatory diet, but still, I still had pain every day. And he said, so you've never been pain-free for 4 years? I said, absolutely not. Absolutely not. It's not a 10 every day, but it's never a 0. So it ranges from 1 to 10, but never 0. And he said, you've never been out of pain? I said, no, sir. Every single day. Some days are worse than others. And he was in complete disbelief because he's like, wow, really? I'm like, yeah. So long story short, well, short story long. I don't know at this point. But he decided to give me, he said this was a diagnostic. He decided to give me a lidocaine injection into that spot that he put his finger on. He said, this is going to tell me exactly what this is. And if it gives you 0 pain after the shot, then this is not endometriosis. But if your pain insists, then it might be endometriosis, but you still would need a laparoscopic procedure to go in and do some exploration and find out. But if this pain goes away after this injection, ma'am, this is not endometriosis. And I said, so are you telling me I was misdiagnosed by 2 other doctors? He said, I'm not going to say that because you could still have endometriosis with no pain. But what I will say is this pain right here has nothing to do with endometriosis if this shot helps. I said, okay. He was like, do you want to do the shot? I said, give me the shot. Now the shot was terrible. It took way too long. It wasn't just a stick and prick. That shot took a long time. He had to first numb the top layer and then go deeper and then deeper so he can get into the muscle wall and put the lidocaine in the right spot. So it took a long time. And I heard him say that, okay, now that I've got you numb, I need a bigger needle to go deeper. Wasn't excited about those words at all. The resident, I grabbed her arm and squeezed her, and she was like, it's okay, you can squeeze my arm if you need to, it's all right, just you'll be fine, it's okay, I'm all right. So she was so sweet. But y'all, once the injection was done, he said, okay, I want you to press down here on your abdomen, press it, push it. And I was scared because I'm so used to it being irritated. Like, I would sometimes have to unbutton my pants halfway through the day because I just couldn't take it anymore. That's how it was. And he was like, go ahead and feel it. I'm like, I don't want to. I was nervous. He's like, go ahead and push it. Do you feel anything? Are you in pain? I'm like, I have 0 pain right now. I could not believe it. I had 0 pain. And he was like, yep, that's not endometriosis. Baby, I wanted to run a lap around the hospital. Do y'all hear me? I said, what? He was like, that's not endometriosis. That's nerve damage. So apparently, when you have a C-section, and especially with me having multiple C-sections, they have to cut across this nerve. And sometimes it causes nerve damage. But not only that, the scar tissue that forms after the C-section can trap the nerve. And the nerve gets irritated. So it's like an irritated nerve inside of a scar tissue ball. And that nerve is in there upset, angry. But you got scar tissue around it. So there's nothing you can do about it. So what he did, the injection went into the scar tissue. And he said I had a lot of scar tissue because it was hard for him to get it in there. He said it felt gritty. That's the term he used. And he said, I don't know how long the lidocaine will hold you. Some people, it completely fixes the problem. Some people, it wears off after a couple months. Some people would last some years. You just don't know. And I'm praying that it lasts forever and ever. But he was honest with me. He said, I don't know how long this is going to last. The only other option would be to get the nerve clipped, or I don't know, but to get the nerve removed pretty much. And I was like, well, is that going to cause any issues? He was like, no, you can get that nerve removed. You got plenty of nerves in that area. You'll be completely fine. Praying it doesn't come to me having to get another surgery. But I said all that to say, this is called abdominal wall nerve entrapment. Another term that they use is called acnes, ACNES. So all that time, all those years that I suffered with this pain daily, the whole time, all I needed was a lidocaine shot. Can y'all believe that? Can y'all believe that? After seeing 3 different doctors, 1 surgeon, and 2 CT techs, it took all of that for me to find out that this was simply abdominal wall nerve entrapment. This is an angry nerve that's trapped in scar tissue. So I do not have a condition that I'm going to have to live with the rest of my life, and there's no answer and no cure. This is actually something that can be fixed, and that gave me so much hope to know. So if you're a woman who's been experiencing similar pain in your abdominal wall, and it doesn't feel like a deep pain like endometriosis, but more like a surface level, stinging, sharp, stabbing pain, then you may want to get a second opinion. It might not be endometriosis at all. Okay, that is my experience. Again, I am not a licensed professional. Thank you guys so much for watching this video. I pray that you have an amazing day. I hope this answered a prayer for somebody, because I know I had been looking for answers for 4 years and couldn't find any. So I hope this was an answered prayer for some woman out there. Sis, you do not have to live with pain. Pain is not your portion. If you can relate to this experience, or maybe you've been having the similar pain and you haven't got it checked out, leave a comment below and let's talk. I'll share more details about my experience, or what to ask your doctor the next time you go to an appointment and say, look, I watched this girl YouTube video and she told me that this might be nerve damage. So thanks again. I'll see you guys in the next one. Peace out.